Kosta Diamantis has been found guilty after being charged with extortion, bribery, and making false statements while working under the Lamont administration. Could his trial and conviction have any impact on the governor? And many of you who get health care through Access Health are starting to see your bills for 2026, just how high they are, and what could happen if this government shutdown continues. Joining us to talk all about it is Dan Haar, the senior editor and columnist at Hearst, Connecticut Media. Dan, thanks for being here. Let's start with the Diamantis conviction and your thoughts on if this could spill over at all into the current administration. Certainly Lamont gave his comment that, you know, as soon as he heard about anything, he was fired, and he wasn't even called as a witness in this case.
That's right. The most important thing about this case is that despite the finding of guilt for Mr. Diamantis, the governor never had to testify. He was able to. He didn't really even have to quash the subpoena. It was just found that his testimony would have been irrelevant. And that finding is very important because it means that neither the defense nor the prosecution brought up any connection, any sort of metastasis into the administration of Lamont. And so in that sense, it is possible for Republicans to say, as they are, that this conviction shows corruption in state government, not corruption by Lamont, but corruption in state government. Lamont is able to say, we took care of it. Now, there's another shoe that's going to drop. So that's the trial that comes in February. And that is of Diamantis' second trial on charges that he and another former state legislator pressured the State Department of Social Services to drop an audit by someone who was a fiance. It gets a lot of the connections here. The long and the short of it is this second trial on corruption charges in February is much closer to the administration. And so the danger still exists for the Lamont administration. Not to say there's anything implicating the governor directly, not at all. There is.
Okay, let's move on to Access Health CT. If you are part of someone who buys your health insurance on the exchange, you're going to see your bills go way up because of the government shutdown. What does this mean for the big picture and the shutdown?
Well, for the shutdown, this is the nut. This is the thing that the Democrats are holding. The expiration of these credits that enable people to get, and it's middle class people. It's not the poor who are either on Medicaid or on higher levels of Access Health of Obamacare. It's people who are 300% and 400% of poverty, right? Families making up to $120,000. They're going to see the largest increases because those are the subsidies that came about during Obamacare, which are now going away. And so what it does is it's really tightening the screws on both sides because people are seeing their bills now. We're talking to actual people who have seen bills doubling, tripling, and tripling is the largest. And that's going to apply pressure on the Democrats to cave and on the Republicans to settle.
Okay, we'll have to see what happens. Dan Haar writes about politics for CT Insider. You can take a deeper dive with his columns on ctinsider.com. Thanks, Dan. And now let's get you town by town.